Beautiful, absolutely fantastic. I know you guys are proud of it, as you should be. I know you guys have been here all morning. Everybody's hungry, everybody's tired of sitting down. So if we can all agree to get vaccinated and wear masks, I'll go home. You know? Do I have control of these slides, or do you? Thank you. So, a couple of disclaimers to get started, guys. I have no financial affiliation with Pfizer, Moderna, CDC, NIH. Neither I nor any doctors I know make any more money when you get vaccinated. So there's no conflict of interest there, but you'd be surprised with what I hear. So we'll get that out of the way first. So we find ourselves summer of 2021 in an interesting, scary confluence of circumstances. The Delta variant is alive and well in our community. It's just at the point where we're starting to worry about waning immunity from vaccines and from prior infections. School's about to start. We are in an environment of poor vaccine compliance, and I'll be honest, it scares me to death. The nurses and the doctors and the EMTs and the respiratory therapists and the hospital administrators and the people that clean the hospital and everyone else you know in healthcare right now is tired and overworked, and we are really in for a tough time, I'm afraid. But I'm not here just to scare you, I'm here to try to elucidate the lay of the land and let you guys know what we're looking at and where we are. Scope of the problem, 612 total deaths from COVID-19 as of the end of last month. That's roughly equivalent to what we lost in the Civil War. Those are US deaths, bloodiest war in American history. If you add up Revolutionary War, the War of 1812, World War I, World War II, Vietnam, and everything that's happened in the Middle East, that's roughly equivalent to the American lives lost from COVID. So anybody that tells you it's not a big deal, I want you to use that kind of perspective when you're thinking about it. I'm not going to go through 1,000 slides with you guys. My idea is to do a little bit of front matter and kind of where we are, and then open it up to questions if you guys have any. From April 1st, 2020, which was about when we first started seeing COVID in our area, to July the 28th of 21. So we're looking at maybe 16 months there. We had 100, this is in our town. So I thought that would be more relevant to you guys than what's happening in Little Rock or New York or globally or nationwide. So in Magnolia Regional Medical Center, we've had 164 patients hospitalized for COVID-19. 21 of those patients were placed on the ventilator, 15 of those patients died. We have had as of that point, we had one patient hospitalized who was vaccinated. No one who was vaccinated went into the ICU. No one who was vaccinated has been put on a ventilator. No one who was vaccinated has died. So if we break that down into before and after vaccine numbers, from April of last year of 2020, the beginning of the pandemic locally, to February the 2nd, which is the first date that anyone in Columbia County could have been fully vaccinated, okay? So before the vaccine, 121 patients hospitalized, that's 11 patients per month, 15 patients on the ventilator, and 10 of those patients died. Since that time, when vaccines have been available, understand, vaccines have been available. We have only 31.6% of our population fully vaccinated, so that plays into these numbers. But since vaccines have been fully available, we've had 7 patients per month hospitalized, 6 patients placed on the ventilator, 5 of those patients have died. Again, none of those patients were vaccinated. None of the deaths were vaccinated. As of last week, we had 88 total active cases. This morning we have 117 total active cases. We've got 31% of our population fully vaccinated and 11% of our population partially immunized. Those numbers have bumped up in the last week, about 1% each, as of this morning's numbers. All right, that's the lay of the land. The rest of my slides have to do with answering questions, because one of the things I'd like to impress upon you all is when you're talking about COVID, coronavirus, the origin of the answer to the question matters. In other words, if the answer to the question came from I heard, starts with I heard, or if the answer to the question starts with, well, Facebook says, or if the answer to the question starts with my mother's cousin, that is not necessarily those are not necessarily the best answers to the questions. We're faced with a scientific problem that's going to require a scientific solution. And for our science teachers out here, you probably know the steps of the scientific method better than I do, but Facebook's not involved, right? And so if we're trying to answer a scientific question, we need to use the scientific method to answer those questions. And so that's what I've tried to do, is go back for my answers to the questions. And some of my answers to the question, I may answer a question of yours with the answer, I don't know. It won't be for lack of trying. I think I've heard every question. But sometimes we don't know. And that's a better answer, if that's the truth, than what I heard on Facebook or what I may have seen, even in one of my patients. Not to say that anecdotal evidence is irrelevant, but the problem we're facing is large enough that I think we should give it the respect of having answers that have been vetted, peer-reviewed, and that we can back up with the science. So with that, I'll open the floor to any questions that you guys may have. Come on. Yes, ma'am. The latest evidence, this is not evidence, I'll try to choose my words wisely. What the guidance that we've been given from the CDC is that approval for vaccine down to the age of 5 and potentially down to the age of 2 should come in October.
Will there be a booster that follows the vaccinations that have already received?
That's a really good question, and it gives me a chance to what you guys will find is that I may give you long answers to short questions, okay? And the reason for that is that very few answers are yes or no when we're talking about these kinds of questions. As of Friday, a study that came out in The Lancet, which is one of the British medical journals, indicated that there was no waning of immunity from the vaccine. That holds true for Moderna, Pfizer, and Johnson & Johnson, okay? No waning of immunity from the vaccine. Now, it's important to understand that the way we test for that is to test antibodies. And your antibody level does not directly correlate with your immune status. There is no such thing as a perfect correlate of immunity. In other words, there's no test that I can run on any of us can run on anybody that says this is how immune you are. What we can test for are your antibodies, and specifically your IgG antibodies, which are present in your lungs. COVID passes through your nose and mouth. We can't test very well for IgA antibodies, which are in your nose and mouth. So the answer to the question, the best answer I can give you is that IgG antibodies are persistent at high enough levels that we would think would confer immunity through 6 months. That is the true answer to the question. Now I'm going to step over here on the side and I'm going to give you an opinion based on that study and several others. I believe that where we are going with this is one day having an annual vaccine, probably a single dose, like we do for the flu. That's different than a booster because an annual single dose vaccine would hopefully, theoretically, be geared towards whichever variant is likely to be most prevalent in the community or in the population, which is very similar to the way that we do influenza vaccines. So the difference between the Delta variant and an influenza strain is just nomenclature. They basically mean the same thing. That's a long answer to a short question. The boosters, no. Potential revaccination on a yearly basis, quite possibly. Does that answer your question? Okay.
What is or is there a percentage, a goal percentage that gets towards vaccinated and gets towards herd immunity?
It's another good question. It depends on the variant that we're talking about because the Delta variant is so much more transmissible. It will require a larger percentage of people to be immunized. Now, immunization can come from a vaccine, or immunization can come from having had the virus. After I get sick with the virus, I am inoculated, immunized for all intents and purposes. Immunization from infection doesn't last, believe it or not, doesn't last as long and is not as robust as immunization from the virus. So, if everyone could get, if you guys would all agree, let's all get COVID at the same time. If you're not immunized, if everyone gets COVID at the same time, then 6 weeks from now, we will all be inoculated, immunized in one way or the other, and it would go away. It would take about 2 weeks for the virus to burn itself completely out if we could achieve 100%. But the short answer to your question is for Delta, they're looking at 85%. For Alpha and the original ancestral strain, probably around 70 or 75% immunized. Other questions? Yes, ma'am?
Could you please explain, this is something I hear a lot of people confused about. Could you please explain how being vaccinated does not mean you can't necessarily get infected and it might still multiply, for example, in your nasal passages, but
Right.
that doesn't mean the vaccine didn't work?
Great.
Can you explain that to us, please?
Yeah. So this speaks to that a little bit. In the next couple of slides, we'll speak to that a little bit. The game changed a month ago, guys. The game changed with the Delta variant. And the reason the game changed is because the virus did what viruses do. What viruses do is try to find a way to infect more people. The virus wants to do is it wants to pass its genetic material to as many hosts, that's us, as many hosts as it can. And it mutates in order to do that. And so when we got the Delta variant, one of the dangerous mutations in the Delta variant is based on one of the proteins that allows that Delta variant to multiply so much faster and have so much more reproductive capability within our cells. So I'm going to answer your question. I'm kind of having to come around to why, okay? China study done in July, I think it was, of this year, that's going to be a couple slides down, but a China study done in July of this year showed that there were about 1,000 times more viral particles in the mouth of someone infected with Delta versus someone infected with Alpha or Lambda or the original strain. What that means is that I've got more virus in my mouth and nose, specifically, I said mouth, and specifically it was in the nose, but I've got more viral particles in my mouth and in my nose when I breathe, or when I sing, or when I speak, or when I sneeze, or when I cough, more viral particles are released into the air. So with Delta, the R naught value is somewhere around 7, 8, or 9. Let me back up and understand this. The R naught value is if one person is infected with a disease, how many people will that one person be likely to infect on average? So for seasonal influenza, that's about 1.2, 3, or 4. I've got the flu, I'm liable to infect 1.2, 1.3 more people. For the original COVID virus, the R naught value is about 2.5 to 3.5. Some people say maybe as high as 4. So if I've got COVID, I'm liable to infect 2.5 to 3.5 other people. The R naught value for the Delta variant is 8 or 9, which puts it on par, pretty close. And I think this graph is going to change. That blue box is going to move further to the right, puts it on par with chickenpox and approaching the infectiousness of measles. So what that means is that so many more people are going to be infected. And if there is a 10% hospitalization rate, well, that many more people go into the hospital. There's a 1% death rate, well, it's that many more people die. And so it's just going to be more and more infectious. That is especially, so those numbers I'm giving you are especially true for Delta, and that is what has driven the idea behind the very unpopular notion of vaccine and masks. It's just that contagious. It's just that contagious. Does that answer your question?
Mostly. I just heard a lot of folks say they don't understand how the vaccine would work, and you still also be able to infect. So you got.
Okay. Let me come at it from a different angle and say, let's talk about what an effective vaccine is. Okay? Does the vaccine work? Okay, against the original variant, the vaccine was 93, 97, 98% effective. You can read different numbers based on different studies. Against Delta, we think the vaccine is 85% effective. So I haven't asked you guys if you've been vaccinated yet, because I don't want to offend anyone, but I'm going to ask for a show of hands. How many people know 100 people who have been vaccinated? Come on, you haven't think about it. You know 100 people, probably, who have been vaccinated. Make it easy. How many people know 10 people who have been vaccinated? Okay. If you know 10 people who have been vaccinated, in 1.5 of those people, the vaccine didn't work. Right? 85% effectiveness. In 1.5 of the 10 people that you know that got vaccinated, the vaccine didn't work. But can't tell who those people are. I don't know if it worked in me or not. Do I fall in the 85% range, or I fall in the 15% range? I think I'm in the 85 statistically, but if I'm in the 15, and I don't wear a mask, I have the potential to infect 8 or 9 other people. Those are 8 or 9 people that I'm around, which is probably 8 or 9 people that I care about. All right? Yes, ma'am.
Let's say you've been vaccinated and you get exposed to somebody that is positive. How long would you recommend waiting, the 66 days on quarantine, because you've been vaccinated? How long would you wait until you got tested yourself, to see if you were infected, or would you?
Medically, yes, ma'am. Medically, the perfect timing is 5 days. Yeah, that's when you're most likely to be shedding virus that we can pick up with a test. You would get tested before then. Right. Asymptomatic at 5 days makes the most sense. Yes, ma'am.
So since we can't require people to wear masks.
Yet? Yes.
Would you suggest we just still keep our desks in the classroom 6 feet apart? Or what are the measures we think we do? Especially not theater teachers.
Right. I'm not sure I should comment on school policy.
I just want to see you sweat a minute.
Yeah, right. Where are you? You get the voice coming out of school.
That's awesome.
So the question was, since there is no mask mandate as of now, what's the best way to protect ourselves? Is that fair? And I think all the things that we've heard about for the last 18 months now, 19 months apply. I think regular hand washing, hand sanitizer, social distancing. I mean, 6 feet is not a random number that they pulled out of the sky, right? This is not, we're not dealing with laser beams or force field or magic vapors. We're dealing with particles that have a weight. When I breathe, some of those particles come out, but the weight of those particles takes those particles to the floor. So 6 feet, social distancing, I think that's all you got. Yes, ma'am.
Can you please elaborate on how vaccines affect your immune system when you get it, affecting it close to antibodies and why people get sick afterwards?
Yes, ma'am. So the question was elaborate on the function of the immune system, and I'll try to do that before breakfast in the morning. Okay. So this is an important point. I alluded to this just a moment ago. When a person gets a vaccine, that is not the equivalent of an invisible force field that goes in front of that person's nose and mouth that does not allow viral particles to enter the body. Right? Right? So when a person gets a vaccine, what the vaccine is supposed to do is the vaccine is supposed to teach your immune system how to deal with a foreign invader. So we've all heard, I'm sure, that you cannot be allergic to anything the very first time that you're exposed to that thing. And that's a truism of allergy and immunology, which means the first time I eat shrimp, I cannot be allergic to shrimp because my body doesn't know what to do with it. The second time I eat shrimp, or this 200th time I eat shrimp, I can become allergic to shrimp because now my body has seen shrimp before and it's going to react to that shrimp. Okay? That's true with everything in the immune system. There has to be an initial contact and then subsequent contact before my immune system can respond. So the way a vaccine works is to hopefully teach the immune system how to respond appropriately to a foreign substance. So if I am vaccinated against COVID and I inhale viral particles, I have viral particles in my body. And the difference between a successful vaccination and no vaccination is that if once those viral particles get into my body, if my immune system knows what to do with those viral particles, then my immune system will kill those viral particles within hours or days. If my immune system doesn't know what to do with those viral particles, then they will infect my cells, use my cells as a replication factory, and create more viral particles. So I may have gone down the river with you on that one. Did that answer your question?
Yes, and it was more of a explaining to people that the vaccine probably can respond to making them sick.
Right.
Attacking it, and
Right.
that causes the less of a serious reaction to actually your substance.
Correct, yes. And so what I tell people when they say, man, my arm hurt after the vaccine, I say, that's good, that means it's working. Or I felt sick after the vaccine, that's good, that's because it's working. I touched just a second on effectiveness, go ahead, yes, sir.
You notice the switch from what, when they took the Moderna, did they take the Pfizer or what the other ones for the second vaccine? They didn't get.
No, ma'am, I wouldn't recommend that. I think if you had if someone had an anaphylactic reaction to the first vaccine, then they should not take the COVID vaccine ever again. Now, if someone felt sick, pretty sick after the first vaccine, then the correct answer to that question is I don't know. I don't think that's been studied. I think that'd have to be on a case, but exactly what happened, I think I need more detail on that. Okay, I'm sorry.
Dr. Frank,
Yes, sir?
what is the threat looking like for children specifically? I know Children's Hospital has had a few cases of children specifically. But
Yes. So as of last week, there were 25 patients in as of the beginning of last week, it's a little bit dated. There were 25 patients in the hospital with COVID at Arkansas Children's Hospital, and 5 of those patients were on the ventilator, which is something that we did not see at all during the first surge. This variant appears to be much more contagious for our children, and the next few weeks will tell us a lot. We're at the beginning stages of really understanding Delta. 1 month ago, there were 52 ICU beds available. Excuse me, that's not true. 2 weeks ago, there were 52 ICU beds available for adults and children in the state of Arkansas. This morning, there are 25 ICU beds available in the whole state of Arkansas for adults and children. The impact of the pandemic, can't stress enough, cannot just be measured by number of COVID cases, number of COVID deaths, and how bad did I feel when I tested positive for COVID. The impact is of those 25 available beds, most of those are unusable because our hospital staff is so short-staffed that we can't fill those beds because we don't have the nurses to take care of those people. So if I have to go to the emergency room this afternoon with crushing chest pain that goes up into my neck and down my left arm associated with shortness of breath and nausea, and I know I'm having a big one, there may not be an ICU bed available for me. It has nothing to do with whether I got vaccinated with COVID or not. It has to do with just resources. And the resources of their health care folks are really stressed right now.
Can you talk just a little bit about the vaccine and fertility?
About the vaccine and fertility? Yes, sir. So let's be real clear that neither Pfizer nor Moderna nor the New England Journal of Medicine nor UC San Francisco nor anyone is going to say, I'm going to take 100 pregnant women and give 50 of them the vaccine and 50 of them not. In the United States of America, we do not do research on pregnant women. And that goes back to thalidomide. Some of you history teachers will remember better than I do. I think it was in the 40s or 50s. But medical research during pregnancy is taboo in this country. So it's just not done. So what we do know about lactation, pregnancy, fertility are posterior, looking back studies. I would say we gave the vaccine, didn't know if this person was going to get pregnant or not. Turns out they did get pregnant. Turns out they did, start breastfeeding, and then what happened? So there's no prospective randomized double-blinded placebo-controlled trials about that, and there will not be, at least in our country. So the original Pfizer vaccine trial had 37,000 patients. Roughly half of those were women. 23 women conceived during the study. We don't know whether that was on purpose or not, but in the normal course of human life, 23,000 of those women conceived. 12 of those women were in the vaccine. Turns out, retrospective analysis, 12 of those women were in the vaccine group and 11 of those women were in the placebo group. So here's your Facebook headline. Pfizer vaccine increases fertility. Right? That's what the numbers look like, right? So that's what we know as of now. We've had 100 as of July 26th. For those of you who get vaccinated, there's an app called the V-Safe program that you may have been asked to participate in, where they check in with you every once in a while, how you doing. And since I'm not a woman, they didn't ask me, I guess, if I was pregnant or not, but 139,000 pregnant people have indicated on that V-Safe app that they've had the vaccine. And I think probably just as importantly, 22 million Americans have tested positive for the disease in the last 18 months. That's positive tests for asymptomatic people who don't get tested, maybe even not asymptomatic people. We all know those people who says, I was around somebody that got sick, and I got sick, and I'm not going to get tested. We know those people, right? When we take all those into account, potentially as many as 70 million Americans have had coronavirus. And there's not been 1 ounce of change in our birth rate. I mean, after 18 months, I think we know if there was a fertility problem. Does that answer your question? Oh, the only one that's actually, there's one study that's a preprint that just came out a couple of weeks ago. It's not been peer reviewed. It's not been published yet, but they're looking, again, it's a retrospective study, but they're trying to answer that question in particular because it seems to keep popping up on social media. Any other questions? Lisa, I don't know. That's a good question. I've not looked at those. Are those rapid tests or are those something you have to send off? It's a rapid test? I mean, they're pretty easy to do. It wouldn't surprise me if it's a thing. I mean, it's not even harder than a strep test or a flu test. But I have not looked into the effective, the reliability, I guess, of those. The question was about the rapid test that can pick up across the counter. It's a good question. I don't know the answer.
Dr. Franks, thank you.
Guys, it's been an honor and a privilege.